procedure. If you have a normal kidney function, if you have a disease or your kidney function not normal, like your creatinine not within, then I need to hold warfarin to hold your Aliquis Geraldo or Badax days. When you need to hold your Aliquis or Badax more than 2 days because of your kidney function issues, then I delay to resume this medication. So typically you resume Eliquis 1 day after you have kidney problems, then you might need to resume your Eliquis Geraldo Obedax 2 days or more. Follow your doctor who is your warfarin anticoagulant and surgeon list. You don't have reach your hope for your Eliquis Geraldo Obedax. You should check with the surgeon or procedure list to make sure when it's safe your platinum medication. If surgeon or procedure list to delay medication, you should report that to your doctor who managed your platinum medication or your anticoagulant. They can update the recommendation in the systems. If you have any question, concern, in the comment below. What should you do prior to CAPS procedure? You don't have to hold your platinum medication. Right. By your medication or anticoagulant. If you are taking warfarin, you don't have a in our history, and you have a critical line now recently. You might try not right to, unless your dental oral surgeon know that you have critical line recently. If you have any active bleeding, know to make sure help is at the dental caps. And if they want you to hold your warfarin this procedure, then you probably your doctor the anticoagulant you have to work on the structure. Hold your Alexa, then meet again for doctor. If you have to hold your warfarin or Aliquid, you need to dental when platinum. If they don't wait there when you consult with your doctor, manage your platinum patient or your typhoid for the instruction. You have no active bleed. They may let you resume your platinum medication same day after the so prior to a dental caps procedure, you don't have to hold. Yes, otherwise, check your I9 if needed. I9 recently or I9 history not stable. You have active. You should let your dental or healthcare providers, surgeon know if you have any concern like active bleeding or any major bleeding that you have in that for platinum medication. Okay, if you have any questions, please let us know in for the dental cleaning procedure. What you need to do prior to dental cleaning procedure if you are taking platinum medication like warfarin, Aliquid, Roto, Badaxa. So I would recommend that you should not hold a platinum medication for a routine dental cleaning. Um, if your iron, if you're taking warfarin, you need to make sure you are stable with your iron level. You have critical iron before routine cleaning. You have critical iron probably for you in order to get your iron to the tank. So avoid just have the like over or your iron over 6 or you have any active bleeding with or platinum patient. For the deep cleaning, if you have to have a deep cleaning in, on the platinum medication, consider to hold your warfarin. You need to check with your doctor who manage your platinum medication. They have to review your iron history, and then they will give you some recommendation on your warfarin and your iron history. Generally, if you have a stable iron history, then and then your current iron is therapeutic, and they might recommend that you hold for 1 day prior to the procedure. If your iron, if your iron is not stable and has the history of elevated iron, then they may recommend that you should hold for 3 days prior to the procedure. They need to test your iron prior to the procedure, usually within 24 hours of the procedure. And then if you are taking the Eliquis, Yeroto, Abadaxa, and then you don't have any kind of bleeding, anything, any active bleeding, such as nose bleeding, stomach bleeding, or blood in your urine. And then you might need to hold for 1 day, right, to deep cleaning. And again, if your dentist, they are not concerned about your bleed, don't recommend you have to hold your blood thinner medication, then you should not hold your blood thinner medication. You don't have any concern about bleeding. If you are stable with your warfarin doses, then you have a good history of your INR, um, therapeutic for a long time, then you should follow your dental recommendation. If you have concern, you should always ask for a doctor who manage your warfarin. Make sure you are safe from any procedure. Okay? If you hold your warfarin or your Eliquis, you should resume your blood thinner medication as instructed by dental. If you have any question, you ask your doctor who manage your warfarin when you resume your blood thinner medication. Generally, if you don't have any kind of bleeding or if when to resume your warfarin, then your doctor who manages warfarin might have you to resume your warfarin after the procedure. But you need to double check that's safe. All right. So any further question or any concern prior to dental procedure, what you need to do when you're taking the blood thinner medication, please let me know in the comment below. Thank you. Bye. Hey, prior to a dental grounds procedure, what should you do if you are on blood thinner medication? With warfarin, Eliquis, Geroto, Badaxa, I would recommend should not hold any blood thinner medication prior to this procedure. Otherwise, as instructed by your doctor who manage your warfarin or blood thinner medication or you should check your INR warfarin if you have a critical INR recently, if your INR history not stable, you have active bleeding like blood in urine, stool, puff up with blood, stomach bleeding, nose bleeding, things like that, then you need to let your dental know that you have some concern. And then you might need to make sure your INR not too high prior to avoid any major bleeding. Sometimes your dental may find something that may want to do additional procedure, then will cause a problem. If you're not aware of critical INR or active bleeding. That if they want you to hold your warfarin prior to dental grounds procedure, then you need to discuss with your doctor who manages your warfarin or other blood thinner medication, or you need to discuss with anticoagulation or you have the insurance. And then if they want you to hold your Eliquid, Yeroto, or Badaxa prior to the procedure. For this procedure, you may need to only hold the blood thinner medication prior to the. Again, you need to talk to then your doctor who manage your Eliquid, Yeroto, or Badaxa, or talk to your anticoagulator for the instruction. If you have to hold your blood thinner medication prior to the procedure, then you should ask your dental when to resume your blood thinner medication. If they don't have any instruction, then you need to discuss with your doctor who blood thinner medication or the anticoagulant. Generally, if you don't have any bleeding after the procedure, right, resume blood thinner medication on the same day or a day after the procedure. Do you have any question, any further question? You know, prior to the dental extraction procedure, you are taking anticoagulant like warfarin, Aliquid, or Yaroto. Uh, you should know what to do prior to dental extraction. If a simple extraction would hold any, but would recommend SUI now prior to the procedure. If you have a lot of out range, higher your full range, you should check prior to avoid bleeding. So, if you have multiple tooth extractions, then I would recommend to hold 2 to 5 days prior to procedure. You should check with your dentist. You see, some dentists they may tell you one in between 2 and 3, or they want in less than 2 prior to the procedure. Then you will let your doctor who manage your warfarin know that your INR expect to be at certain level prior to the procedure. Usually, they want your INR on the day or 24 hours prior to the procedure. So if the not stable or higher than the upper range, like a week or 2 weeks prior to the procedure, then your doctor may recommend that you should hold your warfarin to make sure you get or you achieve the I9 goal. Expect to be within 24 hours. So, for example, if your I9 like 3.5, 2 weeks prior to the procedure, right? So, I would recommend you need your warfarin days prior to the procedure. That's on the day of procedure to make sure and 2.3, 2 to 3, and this one. If the dentist one you find than 2 prior to the procedure, 3 days. If you find for by 2 weeks prior, prior to the procedure to make sure you understand too. So it still depends on what your dentist level or goal for the procedure. If you have your I mean, hold your open for 5 days prior to the procedure. Sometimes they or multiple extraction, they make you hold for 5 days. They want the iron level less than one. Hold your work on your iron level. So you have to look closely to make sure you don't have any bleeding. So if you have to hold your 5 days to get iron uh, 1.5, then with the lower knob injection or inoxaparin injection, the blood clot that you take to prevent the or stroke. And if you lower knob injection, there is instruction, when to start the lower knob and when to resume lower knob injection. You have to follow the doctor who manage the warfarin. But that's it's easier manage prior to the procedure. Generally, for a simple extraction, but that's but to extract or extensive oral surgery, then you might need to hold for 1 to 2 days this medication prior to the procedure. You don't have to be rich with the luminal injection when you hold less than 3 days. I think generally it's safe. It's safe for certain patients. They are so sensitive when they hold their blood thinner medication, even though 2 days they may develop the blood clot or stroke. So for those patients, you know, the surgeon or the proceduralist might need to consider the risk and benefits of holding the blood thinner medication. So that's a very complicated patient. Need to work closely. They may need to be stay at the hospital before the procedure to make sure they are safe, or stay after the procedure for days to make sure they are safe from bleeding or blood clot or stroke. If you have to hold your warfarin or the aliquid Yeroto, but that's then resume your blood thinner medication as instructed by dental or the surgeon. So prior to the dental extraction procedure, you need to know if that a simple extraction or multiple tool extraction. If simple extraction, you may not need to hold your blood thinner medication. If multiple tooth extraction or extensive oral surgery, then you may need to hold the warfarin for 2 to 5 days, depending on your Y9 level. And then if you hold more than 3 days, then depending on your medical condition, you need to be breached with the luminal injection to make sure you are safe from blood clot or stroke. And if you take an Eliquis, Yeroto, or Badexa, you may require to hold 1 to 2 days prior to the multiple tooth extraction or extensive oral surgery. Then you should resume your blood thinner medication as instructed by your dental. And if you have to be briefed with Lovenox injection, then you have to follow your doctor who manage your warfarin to make sure what day you need to start the Lovenox and what day and when you resume your Lovenox and when to stop the Lovenox injection. All right. If you have any further questions for this dental extraction procedure, please let me know in comment below. Thank you. Prior to dental fillings procedure, what should you do if you are on blood thinner medication, such as warfarin, Eliquis, Xarelto, or Bedaxa? You don't have to hold your blood thinner medication prior to a dental fillings procedure unless otherwise as instructed by your doctor who manages your warfarin or your anticoagulation or your dental or your oral surgeon. Okay. If you have a unstable INR history, then you may consider to reject your INR. If you have a critical INR recently, then you should check your INR, make sure your INR is not too high prior to the procedure. If you have any active bleeding, you should let your dental or your surgeon know that you have active bleeding. But I don't think that they need to do. They need to postpone the procedure. This procedure that you have bleeding, why not too high? But if you need to talk to them to make sure they don't do anything else besides the fillings. They require you to hold your warfarin, and you need to follow your doctor who manages the blood thinner medication or the anticoagulation. And if they require you, if you're taking the Eliquis, your auto by that time, and they require you to hold your blood thinner medication, okay, prior to the procedure, you have to hold. And if you have to hold your blood thinner medication, then you resume your blood thinner medication instructed by your dentist or your surgeon. If they don't have any recommendation, they have no idea when to resume, then you need to check with your doctor who manages your blood thinner medication or the anticoagulant, and you should resume blood thinner medication. You don't have any higher bleeding after the procedure, then might resume the blood thinner medication the day after the, or even 10 day of the procedure, you have no bleeding done. All right, so again, before a dental fillings procedure, you don't have to hold any blood medication. That's otherwise chocolate. And then you don't have any stable INR history, critical INR recently, then check your INR the bleeding risk I just say for the feelings, do not worry about INA history. But if you have live threatening eating, probably do anything. Hospital eye, they have a puzzle agent push your bleeding back to normal. All right, if you have any further question or concern, write to a dental B. Let me know in the comment. Thank you. Before a dental root canal procedure, what should you do if you are on platinum medication, such as warfarin, Eliquis, Xarelto, Bedaxa? I would recommend you should not hold your platinum medication. Otherwise, as instructed by your doctor or your anticoagulant. If you if you have unstable INR history, your recent INR was critical, too high, then you should check INR prior to the procedure. Make sure you are safe from the procedure. If your INR is therapeutic or you have history of stable INR, good INR history, then you don't have to hold your warfarin right to, unless otherwise as instructed by your doctor who manage your warfarin or the anticoagulant. Or if your dental or your oral surgeon recommend that you hold your platinum medication, then you need to discuss with your doctor who manage your warfarin or the anticoagulant to make sure that you hold the platinum medication appropriately. So if you have unstable INR history or your INR was critical recently, you should check your INR, make sure you are safe. And if you have any active bleeding, you should let your doctor or your anticoagulant clinic know that you have some kind of bleeding, like nose bleeding, stomach bleeding, or blood in urine. You should let your doctor and your dentist, your oral surgeon know before the procedure. Your dental or your oral surgeon may request or may require you to hold your warfarin or your liquid, your total Bedaxa. So if you require to hold your warfarin, work with your doctor or your anticoagulant, how many days you should hold your warfarin, or what is the INR level they want for a procedure. And then if you require to hold your Eliquis, Xarelto, or Bedaxa, then I would recommend you should go for 1 day prior to the procedure. And if you have to hold your warfarin or your Eliquis, Xarelto, or Bedaxa, then you need to resume your platinum medication instructed by your dental or your oral surgeon. If you don't have any instruction or any recommendation from your dental oral surgeon, you need to check with your doctor who manages your warfarin or your anticoagulant to see if they have it. If you have any further question or concern, right to a dental root canal procedure, please let me know in the comments below. prior to dental scaling procedure. So what should you do when you are taking a blood thinner medication, that warfarin, Eliquis, Xarelto, Adaxa? I would recommend you should not hold blood thinner medication otherwise as instructed by your doctor who manage your warfarin or your clinic who manage your warfarin. Or your clinic who manage Eliquis, Xarelto, or Adaxa. If you are taking warfarin and you have unstable INR history, then you need to check your INR to make sure you are not critical prior to a procedure. So if you have a critical INR, you should hold your warfarin until your INR back to the therapeutic level or below your range, be safe for procedure. If you are stable with your warfarin and you have a good INR history in range for a long time, then you may not hold your your warfarin. Okay? If you don't have any active bleeding or any concern about bleeding, then you don't have to hold your blood thinner medication prior to dental scaling. If you have to hold your blood thinner medication prior to the procedure, as instructed by your dental, then you need to resume your blood thinner medication instructed. Make sure have a bleeding can control your blood clot and stroke if you don't not if you take too long to boom for blood thinner medication. So that's one way you need to check your dentist or your oral surgeon to make sure that they have any instruction for you for the procedure. Let them know that you are on blood thinner medication if they have any instruction. If they have no concern, no instruction, then you should check with your doctor or the anti-coag clinics, make sure they have a recommendation, safe procedure. Again, I would not recommend take blood thinner medication before a dental scaling procedure, unless otherwise as instructed by your dental. If you are not stable with your warfarin doses, you have unstable INR history, and have the critical INR recently, and you should talk to your doctor or your anti-coag clinic. Make sure that they give you good instruction what to do with your blood thinner medication prior to that. And then after the procedure, resume the blood thinner medication as instructed by your dental. You don't have any instruction if they don't know what to recommend, then you should follow the doctor or your anti-coag clinic recommendation. Safe. Resume the blood thinner medication appropriately. If you have any further question or concern about before dental scaling procedure, what you need to do, and you are on platinum medication. Thank you. Prior to a total knee replacement surgery, so what should you do if you are on platinum medication? If you are taking warfarin, then your doctor who manage your warfarin for the formalin clinic, they might reject your INR about 2 weeks prior to the procedure. Depending your INR result or your INR history, then if it's too high, then they adjust your warfarin dose, then have you to back in 1 week. And then if you are getting better or get into the range, then they may hold for often for 4 to 5 days prior to the procedure. And if you have a history of recurrent recurrent blood clot or recurrent stroke, then they might need to bridge you with the Lovenox injection. And so when they have to push you with the Lovenox injection, they need to make sure you have up to 2 days kidney labs, within 3 months of kidney lab, and then your current weight in order to dose Lovenox. There are some instructions regarding when to start your Lovenox injection and resume your. You need to follow doctor or like what make sure you reach the Lovenox correctly. And then if you take Aliquid, Geroto, your doctor, excuse me, your doctor who manage your platinum medication or the anticoagulant might check your kidney function. They need to update the labs needed. Usually, within 3 months, and your labs okay. But if it's over 3 months, then they should recheck your kidney labs, your renal labs, so they can give you the good recommendation. If you have a normal kidney function, then probably you would need to hold for like 2 days prior to the total replacement surgery. If your kidney function, if you have some kind of acute kidney problem or have a chronic kidney disease, then based on your screening clearance, and they recommend that you might need to hold more than 2 days. So if you have bad kidney function, then you might go 3 days off, depend on your. And then if you have to hold your warfarin for 5 days, your Aliquid for 2 days or more, your Geroto days or more, then you need to check with your surgeon or the proceduralist to see when you can resume your platinum medication. Generally, for warfarin, you may resume your warfarin a day after procedure if okay with the surgeon. And then for the Aliquid, Geroto, yes, the same thing. You may need to resume this medication a day after the procedure. But if you have a bad kidney function and you have to hold more than 2 days, then probably you need to resume your Aliquid, Geroto, maybe 2 or 3 days after the procedure. Again, you follow your doctor or the anticoagulant who manage your platinum medication and your surgeon or proceduralist. Have any further questions or concerns? Let me know in those.
Hello, Yang. This is a very good question. A lot of people ask me this question when I handle manage the comedy clinic. Yes, some people have to take both warfarin and aspirin. But not a lot of people. Some people have to take both warfarin and aspirin. Aspirin generally take for the platelet, or certain people, certain patients have the AFib, but they don't have additional factors, so they only need take aspirin. But when they have additional factors like over over 75, or have diabetes. So generally, the GAT2 score over 2, they should take the anticoagulant instead of take only aspirin. But some people have to take aspirin and warfarin because they have additional conditions. For example, people who take warfarin for the AFib, and they have to take maybe aspirin for the stent. People who have the stent in their body, they may have to take aspirin for 1 year also. Some people have to take the other end, like Plavix. So, depending on your medical history, your doctor or your pharmacist will reveal whether or not you should take both aspirin or warfarin. Thank you for your question. Do you have any other further questions? Please let me know. Thank you. Hi, Yang Ting. This is another good question. I think generally for the major procedure or surgery, I would recommend to hold aspirin for 7 days. But you need to check with the heart doctor to make sure they are okay for that. Hello, Yati. This is a good question. What is the difference between both? I don't know. I say Motrin is a non-formulary steroid drug. So it's used for mostly for inflammation pain, like ache or muscle pain, muscle cramps, like that. Whereas Tylenol is used for non-inflammation in like my headache or my fever or my back. But just pay attention on the side effect for each of these medications so you probably. So Motrin may affect your stomach like ulceration when you use very high dose or you take eating stomach. So and then it might affect your kidney also. So when you take Motrin, you have to take with a full stomach, and you can take 15 or 30 minutes after eating. And Tylenol may affect your liver. So you should not exceed 4,000 milligrams of Tylenol for any circumstance. So generally you take 500 to 1,000 every 4 to 6 hours, but do not exceed 4,000 milligrams a day. May affect your liver, especially if you have any liver disease. You should consider heavily when you're taking Tylenol. And when drinking too much alcohol, you should avoid taking Tylenol. May affect your liver. For those this is very important to consider when you should take Tylenol or Motrin. That's pretty much what's different in Tylenol and Motrin. If you have any further questions, please comment below. Let me. Thank you. Hi, friend. It's a good question. Basically, this is a general question I used to have. Typically, as you know, we should not take Motrin while we are on warfarin because Motrin is a non-formulary steroid medication. It may cause bleeding when taken with anticoagulant, such as warfarin or Eliquis, Yeroto, any type of anticoagulant. We should not take Motrin. So if you are not allergic, not allergic to Tylenol, you should take Tylenol instead of Motrin.
All right, so next medication is warfarin, Coumadin. So when you should not take warfarin, you should not take warfarin if not recommended by your doctor or or pharmacist. Okay, um, if there's no clear indication for you to take warfarin, clear indication like deep vein thrombosis, pulmonary embolism, fibrillation, or AFib, uh, this is a very clear indication. Warfarin. You should not take any active bleed, any warfarin if you are, or if you have any active bleed, like stomach bleeding, nose, or blood in urine. Did not uh, start warfarin if you have active or significant or major bleeding. You should discuss with your doctor or your pharmacist to make sure uh, they give you the right doses, or they start with a lower dose instead of normal or higher dose, because the warfarin dosing is very complicated. Make sure you ask your doctor and your pharmacist to have active bleeding or you have a history of major bleeding. Warfarin. If you been taking warfarin and you should have the active bleeding, that you need to report to your doctor. They stop it. And if you have life-threatening bleeding, then you need to stop warfarin right away and go to the emergency for further evaluation. And you should not taking warfarin with other blood thinner medication like Alaquip, Xarelto, Rexa. They blood thinner medication. You should complicated medication. If you about switching from warfarin to Alaquip or switching from the other blood thinner medication to warfarin, then there may be some overlap for a few days. For example, if you switching from Alaquip warfarin, then you need to overlap the Alaquip and warfarin for 3 days, or you stop the Alaquip. Make sure warfarin start working in your body after 3 days, like that, but not in together in a daily basis. So your prevent your blood. And when you on warfarin, or you are new to warfarin, and you've been taking the Plavix, and you should check with your doctor to make sure if you still continue on the like Plavix or aspirin. You need to check, make sure you still need to take Plavix or aspirin. And if you have been taking and if you've been taking warfarin, then they just start a Plavix or aspirin, then you need to let them know you're on warfarin. Make sure the Plavix or aspirin they want to start, you need it. Sometimes it's not. Sometimes they don't know if you are warfarin or blood thinner medications. They just start you with the aspirin. Some people have to be on both Plavix or warfarin or aspirin and warfarin because they have different indications. To make sure you don't have to take the medication that not take prevent suicide. You should not take warfarin if you're allergic to it. And then one more thing for the warfarin. So typically, you should hold 4 to 5 days prior to the major surgery or procedure, uh, colonoscopy, knee replacement, or multiple dental extraction. So you should hold 4 to 5 days prior to procedure. That normally, and presuming that, uh, presume that your INA level is at the therapeutic level. And if your INA level, at the supra-therapeutic or out range, then we'll have hold your INA, hold your warfarin accordingly. Because that is different topic, very complicated. And then, after the procedure, then you ask the surgeon for the procedural list. Make sure that it is okay to resume your warfarin, maybe 1 day or 2 days after the procedure, if no bleeding. So I would recommend patient to check with the surgeon or the doctor who perform the procedure. Make sure when it's okay to resume warfarin. So this is very important information for people who have to take warfarin or who have been on warfarin. And when you should report to your doctor, and when you need to go to the emergency room, just stop bleeding, like patient. And when you taking the warfarin, then what medication you should avoid? Check with your doctor or pharmacist. Every time you have a new medication, including over-the-counter herbals, vitamins, check for the drug interaction. That many drugs interact with warfarin, either decrease the efficacy or increase efficacy. Both affect warfarin and affect your body. You check with your doctor. And when you have any kind of bleeding, you need to report to the doctor. Or even you just have abnormal bruising, check with your doctor. You may have too much warfarin in your body, or you may have or eat any food that increase INA or increase bleeding. Just make sure you report it. And pay attention, and sometimes they switch you to a new Latina medication, Aliquix, Geronto, then I need to stop warfarin. When you start a new Latina medication, Aliquix. Make sure that you stop the warfarin if as instructed before any major surgery. Otherwise, they have to postpone your surgery or procedure. You have to wait for a long time. All right, so that is some information that you need to pay attention when taking warfarin or after warfarin. Have any further question or clarify anything? Please let me. Right. Next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But yes, you can do that. But if you don't have any additional medical condition, or if don't know how much you should take, like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, it might fever. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol, drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your partner, because it may affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you on, blood thinner medication like warfarin or Aliquix, but that's it's okay for you to take Tylenol. It's safe to take compared to other pain relief medication. And so, and then the last one is you should not take Tylenol if you're allergic to it. So, be very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So the next medication is fish oil, omega-3. So the omega-3 or fish oil you can buy over the counter, and it's generally safe to take. But I would recommend that you should check with your doctor to make sure you take it correctly. And I would not recommend that you should take the fish oil if it's being expired. You should make sure that it's not expired, so you take the good product. If it's expired, it might cause problems. When it's expired, it no longer effective like it should, but it increase side effect, like bleeding or cramps, nausea, things like that. The main side effect or bad taste, bad smell. It might contain harmful bacteria. When it's expired, it may leaking or broken. You may including some bacteria. And some research indicate that it may lead to increased risk of cancer. By make sure you check the expiration day and take it correctly. Also, you should store the medication in the appropriate location, not too cold, not too hot. Make sure the medication work like the way it should. You should not take the fish oil if you have any active bleeding. So the stomach, you have stomach bleeding or nose bleeding, blood in urine, cup of blood, or if you have after you take fish oil, you have bleeding, or you have any kind of dark or hairy stool, then you may need to stop taking fish oil. And you should not start when you have any active bleeding. That's very important. The fish oil itself may increase risk of bleeding, may cause bleeding. And you should not take fish oil when you taking warfarin and having critical or elevated iron level. If you have iron level about 5 or 6, it might very dangerous. When you take fish oil, it increase risk of bleeding. And you should not take the fish oil to taking other blood thinner medication like Aliquid, Eroto, Adaxa, or the antiplatelet like aspirin or have bleeding or low hemoglobin. Those factors very important to consider whether or not you should continue taking fish oil or start the fish oil. If you have any of these factors, you need to check with your doctor or your pharmacist to make sure that you don't do any increased risk of bleeding problems. And then if you want to take the fish oil, you should not take more than 2,000 milligrams a day without clear indication. Now, if somebody have some sort of increased cholesterol, then they might take about 2,000 milligrams a day. But if you take more than that and you don't have any clear indication or recommendation, then you should not, because there's increased risk of bleeding, or it may have other side effects. So I would recommend that you should check with your doctor if you want to take more than 2,000 grams of fish oil a day. And do not take fish oil if you're allergic to it. Okay? It's very important information, and not a lot of people know about this. I've been working on anticoagulant for a long time, dealing with this supplement a lot. I recommend you should check with your doctor and your pharmacist if you have any active bleeding or if you blood thinner medication are safe from bleeding. And you should not take this medication when it is being expired. And then when your iron is very high, like critical level or elevated, just stop taking this oil. Do not start or eat or supplement or water cup. All right, if you have any question about this over the counters this medication, please let me know the comment. Thank you. Right. Next medication I would like to share with you is Tylenol. Do not take Tylenol if not recommended by your doctor or pharmacist. I know if somebody just go to the pharmacy store and buy some Tylenol over the counter, if they have eye headache, eye fever, or other general pain. But yes, you can do that. But if you don't have any additional medical condition, or if don't know how much you should take, like that, then you need to ask your doctor or pharmacist to make sure you understand clearly before you take any medication over the counter. But you should not take Tylenol if you've been drinking too much alcohol. Drinking too much alcohol, it might affect when you take with Tylenol, it's fever. You take your liver, affect your liver, and then it may cause bleeding if you drink too much alcohol. Drinking too much alcohol. And you should not take Tylenol if you have any major liver problems like active hepatitis, cirrhosis, or liver disease. So you should not start Tylenol without checking with your doctor or your family, because it may affect your liver function. And then do not take more than 4,000 milligrams a day. If you do so, it might affect your liver. Very important, you know the dose. How much you can take a day for the Tylenol. So Tylenol generally is safe to take if you don't have any liver problems, if you're not drinking too much alcohol. And if you are on, blood thinner medication like warfarin or Aliquix, but actually it's okay for you to take Tylenol. It's safe to take compared to other pain relief medication. Okay, so and then the last one is you should not take Tylenol if you are allergic to it. So be very important information about Tylenol, when and what you should take, and then what you need to pay attention. Caution. Make sure you are take the medication safely. All right. If you have any question about Tylenol, please let me know. Thank you. All right. So the net medication, Motrin. This is also available over the counters at the pharmacy like CVS, Walmart, or Walgreens. So you can buy over the counter, or can get prescription from your doctor. But you should not take Motrin or ibuprofen if it's not recommended by your doctor or pharmacist. And you should not take the Motrin if you are on empty stomach, don't have any food in your stomach, may cause problem, stomach ulceration, or bleeding. So make sure you eat before you take Motrin or ibuprofen. If you have major stomach or kidney problems, you should check with your doctor or pharmacist before you take the Motrin or ibuprofen. So major stomach problem like peptic ulcer or gastric problems, or heartburn or GI bleeding or stomach bleeding, blood in urine, or kidney problems. You have the kidney dysfunction or renal problems. You need to make sure you talk to your doctor or pharmacist before you take Motrin or ibuprofen. Okay, so if you are taking warfarin, blood thinner medication like warfarin, Eliquis, Xarelto, or Badaxa, etc., you should not start the Motrin or ibuprofen. If you have, headache or back pain or toothache, things like that, you might try some Tylenol instead of Motrin. Because Motrin may increase the bleeding risk when you are on warfarin or Eliquis or any blood thinner medication. So, and if you taking Motrin or ibuprofen, you've been taking Motrin or ibuprofen, then you should talk to your doctor who give you a new blood thinner medication like warfarin or Eliquis or Badaxa. You should let them know you're on the Motrin to avoid any increased bleeding risk. And you should not take Motrin or ibuprofen more than 4,000 milligrams per day. You take more than that, it might cause very serious side effects like stomach ulceration or bleeding, and it may damage your kidney. So make sure do not take more than 4,000 milligrams of Motrin or ibuprofen per day. And you should not take Motrin or ibuprofen if you're allergic to it. This is very important information. If you have been taking Motrin or ibuprofen, or if you will take Motrin or ibuprofen, pay attention to this information. Very, very important. You don't follow the recommendation from your doctor or pharmacist, you may have problem with medication. Most of people have stomach ulceration that they didn't take the medication correctly. They take on their empty stomach. That easily cause stomach ulceration. And it might damage your kidney. You take too much Motrin, like overdose of, or more than 4,000 milligrams a day. And you may have some kind of bleeding, maybe gastric bleeding, when you take with warfarin or Eliquis or any other blood thinner medication. All right, so this excuse me, this is very important information. I hope that you should pay attention to this information before you start or stop the medication. The Motrin you may take as needed. You don't have to take it every day. Just as needed for your pain. And this is the non-formulary steroid medication. The non-steroid inflammatory medication, NSAID, they call NSAID. Usually, Motrin they take something for your swelling pain. When you get your toothache and you have swelling gum, or you have back pain because the swelling or inflammation of your back, commercial strength, something like that, Oakland may help a lot compared to Tylenol. If you are taking a blood thinner medication, then for Oakland, increased bleeding, and it may affect your kidney function. All right, thank you. Do not take aspirin if, for one, not recommended by your doctor or pharmacist. So, for this medication, it has some serious side effects. So, you should not take it if it's not recommended by your doctor. Number two, if there's no clear indication, for example, the clear indications including, take aspirin for your heart, for your atrial fibrillation, or for stent, protect blood clot due to stent issues. Excuse me. So I would recommend that you should check to see if you have any clear indication for your aspirin. Number three, do not take aspirin if you have any active bleeding, like GI bleed or stomach bleed, nose bleed, or blood in the urine. So any active bleeding, you may need to hold your aspirin. And of course, talk to your doctor or your pharmacist if they have any further recommendation. If you are taking anticoagulant like warfarin, Aliquid, or Xarelto, you need to make sure that if you have to take the aspirin, usually baby aspirin, while you're on the warfarin or Aliquid or any type of anticoagulant, or even the antiplatelet like Plavix. So these medications have the coagulation effect. So make sure you check with your doctor or pharmacist to make sure if you are required to take aspirin while you're on blood thinner medication or not. Or if you are taking the baby aspirin or the regular dose aspirin, the 325 milligram aspirin, then you need to talk to the doctor who give you a new blood thinner medication, like warfarin or Aliquid. Talk to them to see if you have to continue the aspirin while they start you new blood thinner medication, warfarin. And do not take aspirin if you're allergic to it. They have some kind of that reaction. It's very dangerous. Aspirin. So these are very important information for you as a patient to know that why you should not take the aspirin or why you should not continue to take aspirin uh, when you have a new medication such as new blood thinner medication like warfarin, Eliquis, or Adaxa, or Plavix. All right, so any question, concern about this topic, please let me know. Thank you. So the last part of this type of pharmacy law is prescription only prescription. The RX only prescription, or some states they say a C6 or Schedule 6 controlled substance prescription, either RX only prescription or Schedule 6 controlled substance prescription. So the day supply, so no law talking about the quantity may be dispensed at any single building. So most of the insurance limit for 90-day supply. For people who travel overseas or something like that, might request 6 months supply. But like I say, most insurance companies limit for 90-day supply for prescription only medication. And then some medication, it's very dangerous to spend over 3 months supply, like over 90-day supply, medication like antidepressant or antipsychotic. Those medication, they might limit to 90-day supply maximum, like medication like a Seroquel or Lexapro or some medication require to monitor your blood like Coumadin or warfarin. Those medications, they might not give you more than 90-day supply. That is the basic safety, not about insurance, not about the money. That is the safety. Most of the pharmacists or the doctor, they don't feel comfortable, they're gonna comfortable to dispense more than 90. For the refill, there's no specific set time limitation, but many insurance companies and pharmacy systems set for 1 year. Now, after 1 year, you probably need to get a new prescription, or the pharmacy folks, they may call your doctor office to get a prescription renewed. Partial fill is permitted, however, the total amount or quantity in all partial fillings must not exceed total amounts prescribed for prescription. So when the prescriptions expire, I just say valid for up to 1 year from the days where issued from many insurance companies and pharmacy systems. No transfer of refill for the prescription only beyond 1 year from the day of issuance of the original prescription. So the pharmacy cannot transfer your refill to a different pharmacy if the prescription beyond 1 year. So after 1 year, most of the prescription is invalid. insurance companies or pharmacy system. You may ask a new pharmacy call your doctor to get a new prescription or get the prescription renewed. That's all you can do. But the old pharmacy cannot transfer your expired prescription, to a new pharmacy. So this is very important information for you as a patient to understand how the pharmacy fill your prescription at local pharmacy. When they get your prescription, they look at the day of the prescription were issued, and then the day supply, the prescriber or the doctor want, and then some prescription, they, like some chronic disease, you might request 90-day supply, like high blood pressure or diabetes, high cholesterol, those disease, those medical conditions, it's chronic medical condition require you to take for a long time, and you might request 90-day supply for your convenience. And most of the pharmacists accept that request from you. You don't have to ask your doctor for that, and ask the pharmacy to fill a 90-day supply as your request. And then you should know the most of the prescription is invalid or expired after 1 year. Then probably you need to get a refill before that. Otherwise, you need to have the pharmacist call your doctor office to get the prescription renewed. Some medication require you to see your doctor before they can renew. Most of the medication, within your mental health condition, like depression or anxiety or the psycho problems, and you need to see the psychiatrist or you get the prescription renewed. Or some medication required to monitor your blood, like coumadin, to get the lab blood test draw before they can renew your prescription. And like that, you need to work with your doctor. The pharmacy cannot help you with those things. And within 1 year limit, the pharmacy can transfer your refill to a new pharmacy. For example, you got prescription with 11 refills, and then the prescription after 6 months of the day of insurance of the original prescription, and pharmacists can call to a new pharmacy to get the prescription transfer. But after 1 year, they cannot do that. The prescription is no longer valid in their pharmacy system. I think most of the pharmacy set the 1 year cut off for the prescription only medication. All right, so that's all about the prescription. From C2, C3, C4, C5, and C6 prescription. And C6 prescription is the regular prescription or the RX only prescription. Each state they call different. And so you may have to check with your pharmacy, your local pharmacy, to see how they call the Schedule 6 controlled substance prescription. Sometimes they call the RX only prescription. Sometimes they call Schedule 6 prescription or regular prescription. If you have any further question or any concern, please let me know. I'm willing to explain pharmacy law. If you confused or if you don't understand anything about pharmacy, please let me know. I want to clarify or make sure give you the good information that can help you understand why the pharmacy do your medication, why sometimes they don't. They will do your prescription. Thank you. Have a good one. I'm going to continue some very important pharmacy law. This is just for patient information. But good to know this information when you have a prescription, get it filled at the pharmacy. So the last time I talked about Schedule 2, Schedule 3, and Schedule 4 controlled substances prescriptions. Now Schedule 5 controlled substance prescriptions or C5 prescriptions. Again, you need to understand that they supply on the prescription. So no federal or state law regulating the quantity of this prescription, C5 prescription, or Schedule 5 controlled substance prescription. So no law saying, how many they supply. I did anything, any one time. For the refill, no specific or set time limitation. So for the C5 prescription, the law doesn't say how many days supply can be refilled. It's not like C3 and C prescription. It limits to 30-day supplies. So, but many states, may limit refills of C5 prescription by refills within a 6-month period. It's like C3 and C4. C3 and C4 it limits to 5 refills within 6-month period. So it depends on where you live. Your state may want to set the limit, set the time limitation C5 prescription. The C5 prescription may be fracture fill. So there is no law regulating fracture fill or C5 prescription. But the total amount of all fracture filling but not exceed the total amounts required. And when the prescription is expired, it's no specific or set time for expiration. So many states consider the C5 prescription is similar to C3 and C4 C3 and C4 prescriptions. Then the prescription may be just valid for up to 6 months from the day it was issued. So it still depends on your states. Okay. But if your state had no specific or set time for expiration, then the prescription might be valid for 1 year. But most of the insurance company and the pharmacy system is set up for 1 year cut off for prescription. In other words, the prescriptions become invalid after 1 year which were issued. This is very important information for you as the patient understand, why they give you certain day supply, and usually for those states who have no regulation on the C5 prescription, then they might fill up to 90 day supply. It's just like regular prescription medication due to 90 day supply. But if it consider C5 prescription as the C3 and C4, then it may only give you 30 day supply. And again, check your state regulation to see if you can refill the prescription beyond the 6-month period. And most of the prescription is not valid after 1 year. Those very important limitation of the prescription. You let me know if you have any questions for the Schedule 5 controlled substances prescription or C5 prescription. Thank you. There you go. Schedule 3 and 4 prescription. So again, the day supply, or state law, some state law is the maximum 30-day supply per single filling, or be spent at one time. Federal law say maximum 34-day supply per single filling. But only a 5 refill and 6 months. You only have 5 refills within 6 months from the day of issuance of the prescriptions. So after 6 months, you cannot fill the Schedule 3 and Schedule 4 prescription. Make sure you know the time limit. And only fill 30-day supply or 34-day supply per single filling. Okay, so as long as you have enough for medication for 6 months, if you have 34-day supply, then probably you don't have 5 refills, maybe 4 refills. So it might be we need to do some calculation of 4 6 months is equal to 24. Probably you have or refills if 30-40 supply. For box refill, yeah, if the pharmacy is unable to supply the required quantity due to out of stock or the patient request, so it's different with the Schedule 2 or C2 prescription. This C2 prescription, the patient cannot request a box refill. Okay, and then the state law, you but not exceed 30 days supply, and the total quantity in all box refillings may not exceed the total quantity prescribed. And then after 6 months from the day of the prescription issue, you cannot do a box refill or any refill, nothing after 6 months. Again, the prescription may be valid for up to 6 months from the days the prescription issued. So these really basis but important information all patients and pharmacists should know to avoid any arguments when the time that the patient needs medication but cannot be filled, or too soon to refill, things like that. Generally, pharmacists may dispense the schedule prescription maybe only 2 days earlier. If the patient wants to get the prescription too early, they only do 2 days 2 days early for most of the scheduled substances. All right, so this is some pharmacy laws that it occurs every day, and then some a lot of patients, they don't understand this why the pharmacist refill to refill the medication too early, or why they cannot fill the prescription even though they have some refill remaining. And the pharmacies, the healthcare insurance might have some information. For example, if you fill the prescription multiple pharmacy, your insurance may let the pharmacist know that you already fill this medication from the other pharmacy. So the pharmacist will know if you already got the medication for the pharmacy. Right? If you have any question or concern about these pharmacy law, please let me know in the comment below. Thank you for listening. Good Friday, everyone. I would like to talk about pharmacy law today. A lot of patients and some pharmacists confused about pharmacy law every day, especially retail pharmacists. and people who work at the chain pharmacy like CVS, Walgreens, Walmart, um, they face with the pharmacy law every day. So I would like to talk some important pharmacy laws that may be benefits for both patients and pharmacist folks. So I would like to talk about Schedule 2 to 4 controlled substance prescriptions. Schedule 2 is different with Schedule 3 and Schedule 4 and Schedule 5 and the prescription only. So the Schedule 2, like oxycodone, hydrocodone, morphine, those medications control substance Schedule 2 or C2 prescription. So first I would like to discuss about day supply. Okay. So excuse me. So the day supply of C2 prescription, the maximum day supply for the C2 prescription is 30 days. But for some C2 medication, the maximum day supply can be 60 days, like for medication or the dextroamphetamine or methylphenidate for the ADHD. So those medication can be 60 days supply. And some injectable infusion medication during the bumps, they may be okay for 90 days supply. So for these day supply limit is different and vary state to state. So you may need to check with your state law to see what are the supply limits for the Schedule 2 prescription. And the Schedule 2 prescription cannot be refilled. It's prohibited. So no refilling for Schedule 2 prescription. For some reason, prescription for Schedule 2 might be partial fill because they don't have enough medication in stock. So they are out of stock medication. And in that case, the pharmacist might give you some partial fill. But it's very complicated to do the partial fill. Pharmacists need to spend the rest within 72 hours, and if after 72 hours the patient not come back for the remaining, then the pharmacist must report to the prescriber, the doctor who prescribes the medication. This little, it has some a complication if something happened after the partial fill. And then it not permitted the patient request, so the patient cannot request a partial fill. Partial fill only occur if the pharmacy does not have enough medication in stock. So how long the Schedule 2 prescription is valid? Depend on state. Some state it set the time limit like 30 days limit. After 30 days, um, the prescription is no longer valid. So um, you may need to get a new prescription for C2 medication if you cannot fill medication within 30 days. But for some medication, for some patients, like patients in long-term care facility, like a nursing home patient or, patient with a diagnosis of terminal illness, the prescription may be valid up to 60 days from the day of issuance. So, um, for the patient, the prescription um, can be filled within 60 days from the day the prescription was issued. So this is very important. Numbers and informations when you have the prescription for Schedule 2 controlled substances, you need to know some basic information to avoid, the prescription become invalid, and make sure you get enough medication, the total quantity, um, prescribed instead of production fill. If you uh, don't get a production fill within 72 hours, then you cannot get the rest of the medication. And remember to fill the medication within 30 days. No refills permitted. Um, and then understand the state laws to make sure, if you have the prescription for dextroamphetamine or methylphenidate for the ADHD, and some injectable infusion bombs, the medication for infusion, then you need to, make sure you fill the medication within the time limits. All right, if you have any questions, please let me know in the comment below. I'm going to talk a little bit about Schedule 3 and 4 prescription. So, Schedule 3 and 4 prescription.
Hello. This is a very good question. A lot of people taking fish oil nowadays for their cholesterol um, and other medical conditions such as arthritis, inflammation, or uh, or the heart. So there are some rocket action between fish oil and open. Um, some people may experience more bleeding or bruising when taking fish oil and open. So if you have any abnormal bleeding or bruising, you should report to your doctor. Anyway, before starting fish oil or any over-the-counters or herbals, you should check the doctor who managed your warfarin to make sure he or she aware of new medication or over the counters that may increase risk of bleeding when we are on continual medication such as warfarin. And I think fish oil may not affect other oral medications such as Eliquis or Eropa.
All right, the next topic I want to talk is Eliquis versus Pradaxa or the dabigatran. So I have a similar indication for stroke prevention in non-valvular AFib, vena thromboembolism treatment for prevention. Precaution. The Eliquis should be used in precaution when the creatinine clearance less than 25 or the serum creatinine over 2.5. Typically, we use the Eliquis with a lower dose when people have this level, creatinine clearance less than 25 or serum creatinine greater than 2.5. For Pradaxa, we should avoid when creatinine clearance less than 30. And it's not recommended to start in patients with creatinine clearance less than 50. So creatinine clearance at 60 or above is considered a normal renal function. When it's less than 60, it's not normal. And then when it below, when creatinine clearance below 50, then we should not start Pradaxa. And this medication contraindicated with patients who have mechanical heart valves, liver disease, active hepatitis, cirrhosis, significant LFT elevation. When people have the AST or LFT greater than 2 to 3 of their upper limits, then we should not Eliquis or Pradaxa. Pregnancy, people who are pregnant, they should be avoided taking Eliquis, Pradaxa. The side effect, Eliquis is better in terms of stomach bleed or GI bleed. Pradaxa may increase the GI side effects. So people who have stomach problem like peptic ulcer or the colitis or something like that, they should avoid taking Pradaxa. Dosing, the Eliquis and Pradaxa have similar dosing. They take they should be taken every 12 hours or twice a day. For the feeding tube, Pradaxa is not recommended. The Pradaxa dosage form available in capsules. So the capsules cannot be crushed or opened. Capsules may be stored. It must be capsules of the Pradaxa, but be stored in original containers for about when it's open, it's only good for 3 months to maintain the efficacy. When it's open and then it's over 3 months, the medication no longer have the efficacy that it should. So if we open the container, then we should not use this medication if it's over 3 months. With that issue, we don't recommend people to use the bubble bag, for some hospital patient, they used to have the bubble bag for like 90 days set up. And this medication the original container to protect from the light, and they should not be used in the bubble bag setup. The Badaxa do not have interaction with the CYB384 drugs. It has a little bit different with the drug interaction. The Aliquix had the antidote or reversal agent. It's called the Andexanet alpha or Andexa. The Badaxa antidote is either Brucizumab or Brexbite. They have different antidotes or reversal agents. So generally, Badaxa is less common than Aliquix. Badaxa generally used for those people who have the good renal function and they are young. Otherwise, Aliquix should be started in patients have the increased risk of bleeding, have stomach problems like peptic ulcers or GI bleeding, and have renal function problems. And the big disadvantage of the Badaxa compared to Aliquix is the Badaxa cannot be used in the bubble bag setup for the hospital patient. Yeah. The patient who need to use the bubble bags for their medication or all of their medication. All right, if you have any further question or concern, why we choose the Aliquix versus Badaxa, or why we choose Badaxa versus Aliquix, please let me know in the comment below. Thank you. Today I'm going to talking about the Aliquix or Abiciban versus Geralto or rivaroxaban. So how do we know which one is better? How do we know how to choose one of these medications for our patients? So first, these medications have similar indications. FDA approved for stroke prevention in non-valvular AFib or atrial fibrillation, and the venous thromboembolism treatment for prevention for different thrombosis or DVT or pulmonary embolism PE. So first we need to look at the renal function to choose this medication. Generally, Aliquix is better for people who have renal impairment or renal dysfunction. Most of the elderly people who over 80 years old do have renal problems. So we should start or initiate Aliquix instead of Geralto for patients over 80 years old. Eliquis, we need to use precaution when serum creatine clearance less than 25 or serum creatine over 2.5. For these patients with significant renal dysfunction, we need you person. We need to monitor closely, especially we need to test kidney function, the renal function, to make sure patient has no bleeding. For people who have the creatine clearance less than 25 or serum creatine over 2.5, you might need to reduce the dose to 2.5 milligram twice a day instead of 5 milligram twice. For Yeroto, we should avoid patients creatine clearance less than 30. So I just mentioned should not start Yeroto for patients over 80 years old who have some function problem. This medication generally absolutely contraindicated in patients who have mechanical heart valves. Active liver disease like active hepatitis, severe cirrhosis, or significant LFT elevation. If the AST or the the AXT or the ALT over 2 to 3 times their upper limit, then you should not use this medication. People who are pregnant should not use this medication. For the side effect, the most concern and common side effect is bleeding. So the Eliquis is better than Yeroto for the stomach or GI bleed. So people who have concern about stomach bleeding or they have some kind of stomach problems, you should start with the Eliquis versus the Yeroto. Dosing, the Yeroto might be advantage compared to Eliquis because Eliquis is taken every 12 hours or twice a day, but Yeroto take once a day or every 24 hours. But it's must take with a full meal, full stomach. So there is one advantage of the Yeroto compared to the Eliquis because it's take once a day instead of twice a day. For people who have problem to remember taking the medication, then they might start with Yeroto if they don't have any other issue like bleeding risk or kidney problems. For some patients, they need to use the feeding tube, and probably the Eliquis is recommended. This medication, they have similar drug interaction. They should avoid the some inhibitors medication, like CYB3A4 and PGP suppress. So CYB3A4 inhibitor and EGB substrate. They have similar antidote or reversal agent. The andexanet alpha or andexa, the brand name. So generally, the Aliquid is recommended more than the Eroto. Only a few or some patients want one daily dose, then they want to start with the Eroto. You let me know if you have any question on these two medications. Thank you. I'm talking about the Aliquid versus warfarin. So why you will see some people take Aliquid or ibixaban versus warfarin? When you go to Google and you just search for it, Aliquid versus warfarin, you will have about 600,000 results. And so for the first few one, you can find some quick information why they choose Aliquid versus warfarin or vice versa. So the first one from myhealth.net, they say Aliquid is shorter acting than warfarin. Excuse me. So Aliquid is shorter acting than warfarin, and the blood thinner effect is quicker gain and loss after about 24 hours. Aliquid rarely requires bridging because it is shorter acting and can be safely stopped a day or two before any medical procedure or surgery. Yeah, so it's Aliquid's image and the warfarin image here. So it's not always the case. It is just general information. I've been working for the Anticoagulation clinic for many years. So yes, Aliquid, you have to take one twice a day. Whereas the warfarin or Coumadin, you take one tablet, one dose a day. So it have a longer half-life, and it take a longer time to get to the peak effect and get into stable state. So usually we take 5 days to start working in your body when you just start warfarin, and then you take 1 to 2 weeks to get to the peak. Like the peak, and then become a stable state after 2 weeks or so. Aliquid is just similar to the low enough injection or enough suffering injection. So Aliquid is the fixed dose medication. Either take 5 milligrams or 2.5 milligrams twice a day for certain patients. So it works every 12 hours medication. You should take same time every day, every 12 hours, and then the warfarin the same time every 24 hours. Aliquid is very expensive medication compared to warfarin. Aliquid, even though you have a co-pay, it is very expensive. $5 per month and about 1,000 or more for 90-day supply. Warfarin is like $10 for 3 months or so it's very cheap. Aliquid is a new medication. I think it's available in 2018 or so, 2017 until now. It's been studied and it shows that the Eliquis is effective just like warfarin. And for elderly people, it may be convenient. They don't, have to go with the confused dosage with warfarin. Eliquis just take one tablet, fixed dose twice a day. So it may be best for a lot of patients, especially elderly people. Warfarin is very complicated in dosing. Some day you need to take one tablet, some day you need to take half tablet. It's a weekly dose, but you have to take every day. It sounds very complicated. Another advantage of Eliquis is diet. Warfarin might be affected by the vitamin K foods like greens, vegetables like kale, cucumbers, spinach, broccoli, things like that might affect warfarin. Some if you eat more vitamin K food, it might the iron level go down, and if you eat less vegetable, it makes the iron level go up. So you must be stable with vitamin K foods every day. Eliquis is not affected by vitamin K foods, so most of people happy with that. They don't have to watch for their diet. And another advantage of Eliquis compared to warfarin, Eliquis doesn't require close monitoring. Okay, some people, if you are oversimplified and you have normal kidney function, normal liver function, you only required to test your blood, every 6 months. And then for warfarin, you had the maximum they can extend the follow-up is 6 weeks. Okay, so 6 weeks you need to come back to get the iron test, your blood test, to make sure your warfarin level is not too high, not too low. When the iron is too low, it means you don't have enough warfarin in your body. When iron is too high, it means you have too much warfarin in your body. It's make heart bleeding. So that's why they have to test your iron level frequently. If you are stable, your iron very stable, then you can come back in 6 weeks. But if your iron level is not stable, you have to come back frequently, like weekly or 2 weeks or 3 weeks, depending on your iron level. If your iron level is critical, it means it's too high, like 5.0 or 6, then you might need to hold warfarin and come back in 3 days or 2 days, things like that. But Eliquis is not frequent follow-up or test. No test required to make sure the Eliquis is enough in the body. No, we don't have that test. That test is very expensive and is no required. For the side effect, somehow, and then for elderly patient, because they confused, they are not confused with the dosage. So if they take the Eliquis with the instructed dose, then they have no problem with the bleeding. But for warfarin, sometimes they confuse with the dose, and then they may take a wrong dose, and it will cause bleeding. That's one reason The second, based on the study, Eliquis may be better in terms of stomach bleeding, where to work for the elderly patient. And then the Eliquis is it's just like low enough injection, so you don't have to be breached before the surgery because you may only need to hold for 2 days prior to the major surgery or procedure. But depend on the kidney function. If you have a bad kidney function, then you need to hold more than 2 days, like 3 or 4 days, depend on your kidney function. You know. And the Eliquis, they only need to monitor the side effect, which is they need to bleeding. So they need to test your complete blood count to make sure the hemoglobin is not too low. If the hemoglobin too low, it means you might have some kind of internal bleeding. Then you need to pay attention on Eliquis, and then you need to go to see a doctor, the stomach doctor, to make sure it's not caused by the Eliquis. And then you need to check your when you're on blood thinner medication, you need to check your stool and your urine frequently to make sure any kind of bleeding. Check your skin to see if any abnormal bruising. Those things that you need to pay attention, and you need to avoid any physical activity that easily cause fall. So those things need to be careful when you're on any kind of blood thinner medication. So Eliquis generally is really better than warfarin in terms of side effect. More than warfarin is the dose is a fixed dose and they're not required to test frequently, and they're not and the diet, vegetables, greens do not affect Eliquis. So more convenient, and it might be better in terms of side effect for some people. The disadvantage is expensive. Some insurance, some healthcare insurance, they don't pay for it. So you need to work out with your health insurance to make sure they cover. And if somebody worry about their therapeutic or their how the Eliquis work in their body, how do they want to know if enough Eliquis in the body or not. So if for some people like that, they may stick with warfarin. They don't want to try the medication. It's not. It does not need the blood test to make sure it's not too low or too high, like warfarin. And some people need to take one dose, like 2.5 milligrams twice a day. No people because they over 80 years old and their weight is under 132 pounds, things like that. If they have those two factors, then they require to take a lower dose. If their kidney function, if their creatinine greater than 2.5, then probably they need to take a lower dose. For certain people, like people on dialysis, they may be not the best candidate for the Eliquis. They should stick with warfarin. So, if you have any further question or concern about if you are taking any blood thinner medication, please let me know in the comment below. how to switch from Eroto to warfarin. You can go to Google again and type in switching from Eroto to warfarin. You have about 45,000 or 4,500,000 results. So that's a lot, but for the first few results, you can learn how to do open from the rotor. So they recommend that you need to continue your auto open. You start open and continue the year auto together overlap for 3 days. So you stop the year auto in 3 days. Switching from year auto to warfarin. Okay. So you start warfarin and then year auto and then stop the year auto in 3 days. And so hopefully in 3 days warfarin start working. Okay. But if the in 3 days you detect the I9 level is still too low, like 1.2, 1.3, 1.4, and I would continue year for 1 or 2 more, increase the warfarin a little bit to make sure the patient is safe from blood clot. I should to tell the patient to remember to stop year as instructed. Some patients they forgot to stop the rotor. So that's the main thing. By the patient, you might call the patient, make sure they stop the rotor as instructed. Otherwise, may cause bleeding. So usually for the new warfarin start, you check the iron level maybe twice a week. Monday and then the next time Thursday, Friday. So I would recommend that you should start warfarin and then stop the Eroto in 3 days. And then you check the iron. If the iron is still too low, I would recommend for 1 or 2 days. Then adjust the warfarin dose to make sure it's not too high and not too low. And then recheck in about 3 days to make sure patient is not at risk of blood clot or stroke. And then to make sure the patient is not continue taking both medication, the Eroto and warfarin. Okay. So if the iron is still very low and probably need to increase the warfarin, make sure to get to the therapeutic level. And have the patient to report any abnormal bruising or increased bleeding risk. Thank you. How to switch from warfarin to Badax. And I've been switching from warfarin to Badax. You have about 340,000 results. The first few top results, we may have some information. Here, pharmacist.com give you a very quick information. But you stop warfarin and start Adaxa when iron less than 2. So this is general recommendation that how you apply if you are from the hospital setting if you work in the hospital, you might check iron daily. So when is iron less than 2, then you start by that on the same schedule, start the work. And by that is twice a day doses. You take one capsule twice a day. How about the outpatient setting? If you check the INR and INR is less than 2, and the patient has the outpatient clinic, and you are able to give the patient the medication, the Badaxa, then patient can start Badaxa at the schedule of open. Stop open and start Badaxa. When I'm at the therapeutic level, like between 2 and 3, so you have to wait, like hope for 1 day to make sure I'm less than 1 to 2 days to make sure I'm less than for the patient the Badaxa. But if the patient need to, if you need to send the medication to the home, you overnight it may take one day, and then if the INA is at the therapeutic level, then I need to go 1 or 2 days, make sure INA less than elevation. If the INA at the time of visit is like 3 point above the level, 3.1 to 5, then probably the patient needs to hold more than 2 days, like maybe 3 days. And how about if the I9, above 3.6 or so, then probably the patient needs to add to reject I9, just hold one or a half dose or 1 dose to make sure that I9 back to the normal range, and then recheck it for the notice or for the instruction. Depend on the I9 level and inpatient or outpatient status to provide best recommendation when doing from open medicine. How to switch from production to open, or from a bigger trend to open. So go to go, and I've been switching from production to open. You have about 400,000 folks. And when you look at the first few websites right here, when I start a bigger trend when I'm less than lower limit of therapeutic trend, less than 2. Pharmacist.com recommend stop open and start the bigger trend when I'm not. So in the hospital setting, you can do daily INR. So you check the INR, it's less than 2, then just stop, open, and start the bigger trend. But how about the outpatient setting? At the time of business, when INR less than 2, then probably you can hold the bigger trend 1 day, and then start the Badaxa if the patient has the medication on hand, then you may, when the INR less than 2, stop warfarin and start the Alexa. If the patient doesn't have the Badessa on hand, like you need to overnight the medication, and like that, it may take 1 day or so to get to the patient home. So you need to, if the iron at the therapeutic level, then you just hold the bigger pen for 1 day or 2 days prior to the Badessa. If the iron like 3.2, 3.1 to 3.5, then I would hold open for like 3 days or so to make sure that I'm not less than 2, then start the Alexa. But if it's greater than 3.6, I would hold the open for 1 day and have the patient come back in 1 week to recheck the INR for further instruction. So it depends on the INR level in order to recommend when, how many days in order to get the INR less than or switching to that. All right, so how do we switch from warfarin to Xarelto or rivaroxaban? This one is a little bit different. You can go to Google and type switching from warfarin to Xarelto or rivaroxaban. You have about more than 400,000 results. Okay? And for the first few ones, there is some information that tell you how to switch to Xarelto from warfarin. So right here they say from warfarin, stop warfarin and start Xarelto when INR less than 3. You know that for the Eliquis or Vedex, when INR less than 2, but for Xarelto is that 3. Why? Why it's different? Because Xarelto is kind of little bit, it has a little bit longer half-life. So when it has longer half-life, the medication lasts longer, and then it takes longer time to get to the peak effect. So when the iron is less than 3, so you stop the warfarin and start Xarelto. It takes some time for Xarelto to work in your body. So that's why they want the iron less than 3 instead of less than. So and then similar to Eliquis, if the patient had a life-threatening blood clot or having high risk of stroke, then you may need to consider the anticoagulant injection, like luminol injection. So, when you want to switch from Xarelto to warfarin, and then you might need to consider the luminol injection to make sure the patient don't have any stroke risk or any life-threatening blood clot. But when you switch from warfarin to Xarelto, then you only need to know when the iron is less than 3. And, but it's different from the hospital libation and the outpatient patient. So for in the hospital, you may monitor iron or recheck iron maybe daily basis to make sure iron less than 3 before you start the Europa. But how about the outpatient setting? You don't do the iron daily basis. How do you plan for that? For me, when the iron, for example, at the therapeutic iron, then yeah, I just tell the patient to stop the warfarin, and I overnight the Eroto, or I send the patient to the pharmacy window, pick up the Eroto and start the Eroto next day, the same schedule they are taking warfarin. So when I know the iron therapeutic, then it's between 2 and 3, then I'll say go ahead and start the warfarin for tonight and start the Eroto tomorrow. And I know the patient will receive the medication at window, or you have the patient tomorrow via the overnight service. And if the iron not too low, if it's too low, then I would just say take half the warfarin and then start the Eroto the next day at the same schedule of warfarin. What happens if the iron are too high, like 3.5 or 3.5 or 4 or or about 3. So if it is if the iron are about 3.2, then I would just say stop the warfarin for 1 day, and then go ahead and take Eroto the next day. But if it's 3.5, then I might recommend to stop warfarin for 2 days prior to take Eroto. If it's 3.6 or above, like 4, and then stop the Eroto for 2 to 3 days. But if it's more than 4, then I will have to hold it, come back, in 1 week and to retest the iron and go from there. But I don't. If it's above 4, and I have to have the patient to recheck the iron. That's how I switch from warfarin to Eroto. So how you switch from Eliquis to warfarin? You can go to Google and type in switching from Eliquis to warfarin. You buy about more than 300,000 results from this search. But the Top Fuels website have some very important information for you. The first one, say converting the Eliquis or this event. It recommend start warfarin and stop this event 3 days later. So this is correct, but it depends on the warfarin level. For example, the baseline for warfarin, before you start warfarin, you need to get the baseline warfarin. Okay, and the normal warfarin is usually below 0.9 or 0.9. So around that level is no warfarin. The people never are warfarin. But how about if the warfarin level at that time at the baseline very high, like 0.2 meaning 1.2 or 1.3, like that. And you may need to stop at this event maybe days or so. And then the second option, they say maybe stop at this event and then start the voluntary anticoagulant or the injection anticoagulant. So like Lovenox, and then warfarin at the same time. So for some people, they are very high risk of stroke or high risk of complicated situation. So you need to make sure that the patient not have any kind of life-threatening issue. So at that case, you might, if you want to switch to warfarin, and you probably need to make sure warfarin at a therapeutic level. In order to do that, because it takes about 3 to 5 days in order to make sure that I get to intermittent level. In order to make sure that they need to have some form of injection, like local injection, to make sure the patient is not risk of having stroke or dangerous blood clot. So that's about what you need to know when you switching from aliquot to warfarin. But you need to make sure you have the baseline iron, and then based on the iron level, you may need to make sure when it's safe to stop the aliquots. So maybe 3 days later, if you have normal baseline iron, if you have high baseline iron, then you might need to consider to stop the aliquots a little bit sooner. And then if you think that the patient is very high risk of having stroke or dangerous blood clot, then you need to make sure that you have some form of the injection, like low-venom injection, make sure the iron level at therapeutic before you stop the low-venom injection. Make sure the patient not having stroke or dangerous blood clot, like blood clot in their lungs. Thank you. How to switch from aliquot to warfarin? You can go to Google and type switching from aliquot to warfarin. You can find about 300,000 results for last search. Look at the first few results. The first result is telling you right here, say, converting aliquots or abiciphen. So they recommend start warfarin and stop abiciphen 3 days later. So basically, it depends on the warfarin level. For example, if I'm at the therapeutic level, yes, then you may stop. I'm sorry. If the iron as the baseline is normal, I mean, usually the normal iron is less than 0.9 or so. It's the people who never take the warfarin before. So you basically just start warfarin and stop abiciphen 3 days later. But how about if iron is higher than the normal level as the baseline. So you need to properly, start the warfarin and stop the adenosine maybe 2 days later to be safe for the bleeding risk. It also say that if you need to make sure, for example, if the patient is very high risk of the blood clot, like acute blood clot, they just have the blood clot in their lung, and the blood clot is very critical, dangerous to the patient. The patient should not the iron should not be low, or the patient need to have certain anticoagulant in their body. So for that case, then the patient might need to take the warfarin and the injection, like Lovenox injection. So for that case, yeah, you need to stop the Eliquis, and then start the warfarin and the Lovenox together. To start warfarin and Lovenox together from day one for maybe 5 days or more, and then check the iron to make sure the iron levels is at therapeutic, between 2 and 3 or so. Then stop the Lovenox injection and just continue to take a warfarin along. So that's the case that you need to make sure that you how to switch from warfarin to Eliquis. So you can go to Google and type in switching from warfarin to Eliquis or Adixaban. You can find about 400,000 results. But the first few websites help you to understanding how to switch from warfarin to Eliquis or other direct acting oral anticoagulation. So for Eliquis, we'll switch to the Eliquis when the iron are less than 2. So, excuse me. So, for example, if the patient iron is therapeutic at the Coumadin clinic visit, I used to have the patient stop taking warfarin about 2 days prior to starting the Eliquis. So, at that time I had time to send out the medication to the patient. For example, if I overnight, then the patient should receive the medication the following day. Or if the patient pick up the medication at the window at the pharmacy, then the patient have the medication ready to switch to the Eliquis from warfarin. So again, it depends on the iron level, so we can have the patient switch from warfarin to Eliquis from the outpatient setting. So if the patient inpatient or hospitalized, then it's easy to stop the warfarin and try to retest the iron to make sure it's less than 2 before start taking the Eliquis. It's most easier for the patient to switch to the Eliquis when they're still at the hospital. But if the outpatient management, then you need to stop the warfarin for 2 days. If the iron at the therapeutic level, and then start the Eliquis to make sure the iron less than 2. If the iron a little bit high, like 3.2 or 3.3, then I would recommend to start 3 days prior to starting Eliquis. But what happens if the iron at the really high, like 3.6 or above in the time visit? Then I would recommend I would reduce the dose or take a partial dose and then retest iron in 1 week to make sure iron level therapeutic before switching to the Eliquis. And when the iron at the therapeutic level, and just try to hold 1 or 2 days prior to the Eliquis, prior to starting the Eliquis to make sure the iron is. The COVID-19 caused VTE, the venous thromboembolism, the DVT or PE, deep vein thrombosis or pulmonary embolism. You can go to Google, you can type COVID-19 caused VTE. It will show up, about 840,000 results. So the first few results indicate that the patient with the COVID-19 infection might experience an increased risk of venous thrombosis, the DVT or PE. So, and then you can see the most popular website in the medical field is uptodate.com. It also shows that the COVID-19 patient might experience decoagulation disorder. And then in the following website, BostonMedicalJournal.com, is also show that the patient with the COVID-19 are associated with the venous thrombosis. So, yes, the answer is yes, the COVID-19 might cause the venous thrombosis. So, I have experienced some patients who have the COVID-19 vaccine, and they experience the increase of the INA. So the COVID-19 vaccines might increase the INA number. It's not much. It's about between 0.5 to 1 for example, people who normally have INR around 2.5, they may increase the INR to 3.0 to 3.5 after vaccination. So, but it not last long. Usually they experience the INR increase in about 3 to 4 weeks. And after that, they back to the normal target, normal range. So in those 3 to 4 weeks, the patient who have increased the INR due to the COVID-19 vaccines are used to decrease the warfarin dose a little bit, like maybe just a half dose per week to make sure that INR is not out range, it's not super therapeutic. So, so yes, some people have a concern whether or not the COVID-19 vaccine affect the INR level or not. Yes, they avoid production or the bigger trend. If you are allergic to production, you should avoid production for some indication, such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid production if you are taking rifampin, St. John's wort, because this medication may reduce your production effect. You should avoid production if you are taking verapamil, quinidine, azithromycin, clarithromycin, erythromycin, itraconazole, ketoconazole. This medication may increase your production effect. You should check with your pharmacist or your doctor if you are taking any new medication or over the counter when you taking production. Some over the counter like Motrin or aspirin might increase risk of bleeding when you take with production. So make sure you let your doctor or your pharmacist know when you are taking production. You should avoid production if you have major with production. You should not use production for blood clots due to anti-cancer. Typically, for people who have blood clot related to active cancer, they should take warfarin or Lovenox instead. You should check with your doctor who manages your blood thinner medication or the anticoagulation clinic for further instruction. Please let me know if you have any questions in the comment box below. Thank you. Avoid Eroto or rivaroxaban if you are allergic to Eroto. You should not use Eroto for some indication such as anti-phospholipid antibody syndrome or mechanical heart valve. You should avoid Eroto if you are taking rifampin, rifadin, carbamazepine, phenytoin, because this medication may reduce your Eroto effect. You should avoid Xarelto if you are taking ketoconazole, isoconazole, ritonavir, because this medication may increase Xarelto effect. You should check with your pharmacist or your doctor for any other medication to make sure there is no drug interactions between Xarelto and prescribed medication or over-the-counter, such as Motrin or aspirin. You should avoid Xarelto if you are having major and ongoing bleeding with Xarelto. You should not use Xarelto if you have blood clots due to active cancer. This is just for your general information. You should check with your doctor or your pharmacist if you have any further questions. Please let me know if you have any question in the comment box below. Thank you. Avoid Eliquis or ABC band. If Eliquis, you should not use Eliquis for indications such as for indication like antiphospholipid antibody syndrome or mechanical heart valve. You should not take Eliquis if you are taking rifampin, carbamazepine, phenytoin, because these medications may reduce the Eliquis effect. You should avoid Eliquis if you are taking ketoconazole, isoconazole, ritonavir, because this medication may increase the Eliquis effect. If you have to take ketoconazole, isoconazole, or ritonavir, you may have to reduce the Eliquis. You should avoid Eliquis if you have major and ongoing bleeding with the Eliquis. You should not take the Eliquis if you for the blood clots due to active cancer. Generally, if you have active cancer, you may try warfarin or diclofenac instead. This is just for your general information. You should check with your doctor who manages your blood thinner medication, your anticoagulation clinic for further instruction. If you have any question, please let me know in the comment box below. Thank you. Heroin addiction. Addiction means you want to have the same feeling the opioid give you. Opioid effect, it gives you a good feeling like high, so to continue having that feeling. It means addiction. Heroin is an illegal opioid, such as cocaine. Other non-opioid drugs such as marijuana, methaqualone. Marijuana might be legal in some states for medical treatment. And prescription opioids, OxyContin or oxycodone, fentanyl. Methamphetamine is non-opioid. It is stimulant. A lot of people start using heroin after they have hard time to get the OxyContin due to the OxyContin issue lawsuits to the manufacturer, Purdue Pharma. A lot of people will die because of the OxyContin long extended relief effects overdose. The manufacturers had to file a bankruptcy, and now it renamed as Nora Pharma. So when the OxyContin supply has problems, the drug cartels take some advantage about that. They start produce the illegal drug, the heroin. The people who have the abuse, addiction, they are looking for a alternate drugs. They are start using heroin. They are start using heroin because this illegal drug is cheaper, but it's equivalent or stronger effects. Heroin dependence or addiction can be physical or psychological. People who have heroin addiction or dependence tend to be because they want to have the same feeling. In order to get the same feeling, they need to continue to use this drug. When they don't have money to buy the drug, they will commit crimes. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction. Fentanyl is the hot topic right now because many illegal migrants enter with the fentanyl products. So fentanyl is an opioid drug. We have illegal opioids and prescription opioids. Illegal opioids including heroin or cocaine. Non-opioid illegal drugs such as marijuana, methaqualone. Marijuana may be legal in some states, and the prescription opioids including OxyContin or oxycodone. Fentanyl is a synthetic opioid, and methamphetamine. Methamphetamine is a stimulant. The prescription opioids including OxyContin, fentanyl, due to treat a severe pain. How it works? Fentanyl might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. For example, arthritis is a disease that might cause a pain symptom. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid or low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Fentanyl is being manufactured nowadays get into the United States via the Mexico border. People who have the heroin or OxyContin addiction or dependence, they start using fentanyl. Maybe more convenient and it may be cheaper or stronger effects. The OxyContin supply had some issue because there are ongoing lawsuits to its manufacturer, Purdue Pharma. The Purdue Pharma had to file a bankruptcy. Prescription dose for medical treatment, the fentanyl batches from 25 to 100 microgram per hour. Fentanyl 25 to 100 microgram per hour equal to OxyContin 10 milligram every 12 hours. Fentanyl is 50 times more potent than heroin and 100 times more potent than morphine per DEA. So per DEA, the lethal dose is about 2 milligram or 2,000 microgram. Many tablets or pills from these illegal migrants found more than 2 milligram. So one tablet contains more than 2 milligram. It's enough to kill a person who took that tablet or pill. The fentanyl dependence or addictions can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdose because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdose. When people get overdose, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. So people who have addiction or dependence to fentanyl really need medical treatment. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. Fentanyl addiction can be very dangerous. If you have any further questions, please let me know in the comment box below. Thank you. OxyContin addiction. OxyContin is an opioid. Some illegal opioids, including heroin, cocaine, illegal non-opioid drugs such as marijuana, methaqualone. Marijuana may be legal for medical treatment in some states. Some prescription opioids, including OxyContin or oxycodone, fentanyl, hydrocodone, codeine, morphine, methadone, and non-opioid methamphetamine stimulant. What is the OxyContin used for? OxyContin or the oxycodone is extended relief, so it can last for 12 hours. It's used to treat a severe pain. How it works? The OxyContin might block the pain by binding to the opioid receptors on nerve cells. So what is the pain? The pain is just a symptom. It's not a disease. Maybe an arthritis. For example, arthritis is a disease that might cause a pain symptom, such as pain. You may have a severe pain after a surgery or a major injury. You should use non-opioid medication, Tylenol, Motrin, research Soma before an opioid. Or you should use low-dose opioid as possible to avoid major addiction from a high dose or overdose of the opioid. Drug abuse, it can be from the doctors who inappropriately prescribe. Manufacturers may be responsible for drug abuse if they fail to manage their distribution appropriately. Opioid abuse might lead to addiction, dependence. It can be physical or psychological. Addiction means you want to have the same feeling the opioid give you. Opioid effect or the OxyContin effect, they give you a good feeling like high, so to continue having that feeling. It means addiction. It's easy to get overdosed because you want to feel better and better with that feeling. At least the same or better feeling. So you want to have, so it's easy to get overdosed. When people get overdosed, they can be death, addiction, or dependence may cause crimes due to drug dependence, drug addiction. They may not control themselves because of psychological issues. You should seek a medical treatment if you think you have drug or opioid dependence or addiction. To monitor and to decrease the drug addiction, some states have prescription drug monitoring programs. The prescribers, the providers or doctors who require opioid medications. So the best thing to avoid OxyContin addiction, you should take OxyContin when it's indicated, such as for severe pain after a surgery or major injury. You should stop the medication as instructed by your doctor. You may check to make sure you don't have this side effect. You may use non-opioid pain relief medication, Tylenol, Motrin, when you have a pain symptom instead of the opioid. If you have any further question, please let me know in the comment box below. Thank you. What is atrial fibrillation or AFib? Atrial fibrillation or AFib treatment duration. What is atrial fibrillation? Atrial fibrillation is when you don't have a regular heartbeat. Sometimes your heartbeat too fast, sometimes too slow. That means you may have a blood clot in your heart or in your lung. If you are diagnosed with AFib, then you may be on a platinum medication indefinitely for the rest of your life, unless your cardiologist to normal. But that's very rare. Sometimes people have AFib, but they don't start the blood thinner medication yet because they don't have any additional risk factors such as over 75 years old or have high blood pressure, diabetes. Generally, if you have only atrial fibrillation and you do not have any additional risk factors, then you don't have to take the blood thinner medication yet. They may put you maybe aspirin. So when you have a AFib, your doctor need to select one of the oral blood thinner medication. If your AFib is not regular, you may start with the Eliquis, Xarelto, or Badaxa for your convenience. You don't have to do the frequent monitoring tests like warfarin. If your AFib is regular, then you have to take warfarin. So it is depend on what type of your AFib, and your doctor might put you on the best medication. If you have any further question on this, please give me a comment in the comment box below. Thank you. protein C or protein S deficiency treatment duration. This medical condition is one of the hypercoagulable states. When you have this medical condition, it may cause a blood clot disorder or blood clot risk. If you know the cause of the protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, Dabigatran. Protein C or protein S deficiency treatment duration. If you know the cause of protein C or protein S deficiency, then you may need to take a blood thinner medication for 6 to 12 months, especially when you have a blood clot in your leg, like deep vein thrombosis. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication for the rest of your life. The best medication for this indication is warfarin. Other medication like Eliquis or apixaban, Xarelto, rivaroxaban, Adaxa, Dabigatran. So for this medication, I think there are ongoing studies. Antithrombin or AT deficiency treatment duration. This is the blood clot disorder or one of the hypercoagulable states. If you have antithrombin deficiency, but you don't know the cause, you might need to take the blood thinner medication for 6 to 12 months. If you know the cause of the blood clot, and you might need to take a blood thinner medication for 6 to 12 months. If you don't know the cause of the blood clot, then you may need to take a blood thinner medication the rest of your life, especially when you have a blood clot leg or your lung. The best medication for this indication is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Factor V latent deficiency treatment duration. What is factor V latent deficiency? This is a blood clot disorder. It is one of hypercoagulable states. There are two types of factor V latent deficiency. First one is homozygous factor V latent deficiency. This is my single risk of having blood clot. So if you don't have any blood clot in your leg, your lung, then you may not need to take the blood thinner medication yet. If you do have a blood clot in your leg or your lung history, you may need to take a blood thinner medication such as warfarin for 6 to 12 months. The second type of factor V latent deficiency is heterozygous. This is the major or multiple risk of having blood clot. If you are diagnosed with this type of factor V latent deficiency, then you may need to take a blood thinner medication indefinitely, regardless of having a blood clot in the past. The best medication for this indication is warfarin. There are ongoing studies for the other medications such as Eliquis, Geroto, Adaxa for this indication. If you have any further questions, please let me know in the comment box below. Thank you. Antiphospholipid antibody syndrome, AAS, or lupus anticoagulant. Treatment duration. Antiphospholipid syndrome or lupus anticoagulant is one of the hypercoagulable states. People have lupus may have the antiphospholipid antibody syndrome. This is the blood clot disorder. So they may have blood clot in their leg. If you have antiphospholipid antibody syndrome or lupus anticoagulant, you may need to take a blood thinner medication indefinitely or for the rest of your life. The blood thinner medication for this medical condition is warfarin or Formulary. You should avoid taking Eliquis, Geroto. If you have any further question, please let me know in the comment box. Thank you. If you have rheumatic microvalve disease, you may need to take a blood thinner medication if you have a history of blood clot. And how long you have to be on blood thinner medication for this medical condition. You may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for this condition is warfarin. If you have a history of rheumatic mitral valve disease and you have acute blood clot, such as pulmonary embolism, blood clot in your lung, then you may need to take a blood thinner medication for the rest of your life or indefinitely. And the best medication for it is warfarin. If you have any further question, please let me know in the comment box below. Thank you. Pulmonary embolism or PE. What is pulmonary embolism? It is a blood clot in your lung. So how long you have to take a blood thinner medication if you have a blood clot in your lung? If you know the cause of a blood clot lung or the cause of the blood clot, you only need to take a blood thinner medication for about 3 to 6 months. If that is the first time you have a blood clot in your lung. If you don't know the cause, don't know why you have a blood clot in your lung, and if that is the first time you have a blood clot in your lung, you have to take a blood thinner medication for 6 to 12 months. If you have a second time blood clot in your lung or recurrent blood clot in your lung, then you may need to take a blood thinner medication definitely or for the rest of your life. If you have a blood clot in your leg and blood clot in your lung, so that considered recurrent blood clot, you may need to take a blood thinner medication indefinitely or for the rest of your life. as well. If the blood clot is considered at high risk for a recurrence, then you may need to take a blood thinner medication longer, maybe for the rest of your life, or definitely. And finally, if you have a blood clot in your lung and it's related to an active cancer, then you may need to take a blood thinner medication until you no longer have cancer, and at least for 3 to 6 months. So you have to take a blood thinner medication at least for 3 to 6 months and until you no longer have active cancer. If you have any further question about this, please let me know in the comment box below. Thank you. Deep vein thrombosis or DVT. What is deep vein thrombosis? Deep vein thrombosis is a blood clot in your leg. So, how long you have to be on a blood thinner medication if you have a deep vein thrombosis or blood clot in your leg? You have to take a blood thinner medication in about 3 to 6 months if you know the cause of the blood clot. And if that blood clot is the first time in your life. If you don't know what is the cause of the blood clot in your leg, then you might need to take 6 to 12 months if that is the first time you have a blood clot in your leg. If you have a second time of blood clot or recurrent blood clot in your leg, then you may need to take a blood thinner medication indefinitely or for the rest of your life. If the cause of blood clot in your leg is because of an active cancer, then you need to take a blood thinner medication until you no longer have a cancer. This is the general information for how long you need to take a blood thinner medication if you have a blood clot in your leg or a deep vein thrombosis. If you have any further question, please let me know in the comment box below. Thank you. Mitral heart valve treatment duration. If you have mechanical mitral heart valve, you may need to take a blood thinner medication for the rest of your life or indefinitely. The best medication for your mechanical mitral heart valve is warfarin. If you have a bioprosthetic or tissue mitral heart valve, you may only take blood thinner medication for about 3 months. Then you will be put on aspirin for the rest of your life. This is the general information for how long you have to be on blood thinner medication if you have mitral heart valve. You should follow your cardiologist's instructions, including treatment therapy and duration. If you have any further question, please let me know in the comment box below. Thank you. Transient ischemic attack, TIA, or mini stroke treatment duration. So the duration It could be clinical adjustment. So it depends. After the TAA, you might need to take the aspirin or warfarin if anticoagulant is indicated. So your doctor will determine how long you have to be either on aspirin or warfarin. Generally, people take aspirin to prevent another TIA. For some people, they would have to take an anticoagulant, such as warfarin, to make sure they are safe from the transient ischemic attack, TIA, or mini stroke. If you have any further question, please let me know in the comment box below. Thank you. Aortic heart valve treatment duration. If you have mechanical aortic heart valve, you may have to take a blood thinner medication indefinitely for the rest of your life. The best medication is warfarin. If you have bioprosthetic aortic heart valve or tissue aortic heart valve, then you might need to take a blood thinner medication for about 3 months, and then you take aspirin for the rest of your life. This is general information for how long you have to take a blood thinner medication. You have aortic heart valve, your cardiologist will tell you exactly how long you have to be on a blood thinner medication or an aspirin. If you have any further question, please let me know in the comment box below. Thank you. Stroke and blood thinner medication treatment duration. So if you have a stroke and you have to take a blood thinner medication, you know how long you have to be on a blood thinner medication. If you know your stroke because of embolic causes such as atrial fibrillation or heart valve, then you have to take a blood thinner medication indefinitely or for the rest of your life. The best medication for it is warfarin. If it's not because of embolic causes, you have to take a blood thinner medication, but you may need to take either aspirin or clopidogrel or Plavix indefinitely or for the rest of your life. Your cardiologist will decide what is the best treatment therapy and duration. So you should follow their instruction. If you have any further question, please let me know in the comment box below. Thank you. Dilated cardiomyopathy treatment duration. If you have dilated cardiomyopathy and you have a history of blood clot or a history of atrial fibrillation, then you may need to take a blood thinner medication for the rest of your life or indefinitely. If you have dilated cardiomyopathy and left ventricular or LV